Okay, so in this video lecture, it's the fourth video lecture on the topic of disorders, and I want to talk about mood disorders. In the last video lecture, I actually covered quite a bit. We talked about phobias and obsessive compulsive or OCD and post-traumatic stress. All of those are considered anxiety disorders because they all are characterized by irrational worry, right? Remember obsessive compulsive disorder actually has two components. It has obsessions, which are the thoughts, and then it has the behaviors, that is the compulsions. Mood disorders are sort of a whole, they're like, just like when we were talking about anxiety disorder, they're a whole collection. Same thing with mood disorders. So it includes bipolar disorder, depression, seasonal affective disorder. And a couple keys that I want to emphasize once again are right here: impairs your ability to function and causes discomfort. Because one way to think about these are, all of us are a little bit, go through these periods where we are in a more positive, more favorable mood, more desirable mood. And when we're in a less desirable mood, the question is, who gets to say if that's depression or if that's normal sadness or if that's just moodiness, right? So I always want to emphasize right here, it impairs your ability to function. If it makes it difficult to have relationships, to hold jobs, to take care of your kids, right, to concentrate, then let's consider that disordered because it's not being maladaptive. Major depression is characterized by, this is short term, so according to the book, it's got to be 2 weeks, but it's this extreme persistent feeling of despondency. And I meant to look up what the definition of despondency. Basically, it is character, and depression is so hard to describe if you've never experienced it. It is way more than just sadness, but you can kind of think of it as this big old weight that kind of carries around, and everything takes takes this huge amount of energy. Getting out of bed, taking a shower, eating, swallowing can be hard, and it just takes this enormous amount of energy. And so you might think that that being depressed is, it may look like people are lazy, but in fact, it's where the brain is so overactive, right? It's this rumination of these dark sort of thoughts. It makes it hard to concentrate on anything, like as simple as, well, it's nearly impossible to read a book or to watch a television show. Anyway. So major depression, turning away from others. So sometimes it has this facial expression, can't concentrate. For me, that's when I have to become aware, like, am I depressed here? If I can't, if I can't concentrate on something. Or another one that's difficult to express if you've not experienced it is the loss of interest in things you used to like to do. So we do a lot of things throughout our day that give us some sort of pleasure, but the idea that really nothing gives you any pleasure at all, or you can't think of anything. There's not even something that if somebody said, well, what do you want? You can do anything in the world you want to do. You don't want to do nothing, right? And that's kind of hard to imagine if you've not experienced it. This dysthymic disorder is, so major depression may be characterized by somebody who fails to shower, can't hold a job. Dysthymic is a low grade kind of depression. So between major and dysthymic, there really matters of degree, right? How long. I would argue that I've experienced this dysthymic. I'm reluctant to accept the idea that I've had major depression, but I know that I've experienced some sort of dysthymic depression. This slide is not looking the way I wanted it to because it's got the little boxes, but this is supposed to illustrate seasonal affective disorder, otherwise known as SAD. And this is the kind of seasonal depression that people often get in the winter, right? And it's actually caused by low levels of vitamin D. So vitamin D is generated through the skin and sunlight. So one treatment for if you get like the winter blues, right? You start to feel kind of depressed in the winter, but you feel really good in the summer. You know that sensation when you go out and you go to the beach or the swimming pool and you sit down and the sun starts to soak in and you go, ah, it feels good. You know, that's like vitamin D, right? But so one treatment is spend more time in the sun because the best approach is actually natural sunlight. But the other, this is a picture taken right here at my desk. See, it's taken right here at my desk. Let me see if I can show it to you. Oh, you can't see it. Anyway, and that is a full spectrum mood light, or sometimes called a happy light. And the way these are supposed to work is I should actually have it directed more towards me, but it would make my face look really funny. Is it is a full spectrum. So it's got the same light. You can't, not a bright light bulb ain't going to do it. You've got to have the A, B spectrum. And it actually, it triggers or is received through your optical nerve, right? And your optical nerve then causes the production of, I want to say it's not melatonin, but it's vitamin D. But if you get the winter blues, this is a legit thing. Or if you work indoors and you don't see any natural light, or if maybe your apartment is really dark because you live in the basement, you might consider getting a full spectrum light. And you're supposed to like sit in front of it. So it's supposed to be like 12 or 18 inches from my face, and it's supposed to direct to me, or not exactly the same thing as a grow light. Another treatment, if you suffer from seasonal affective disorder, are you can take vitamin D supplements, but you need thousands of international units. So and it works. You know, I've done that too. And like if you buy the little jellies, you might need to take 5 or 6. I think you need like 2,000 international units, and each one of those maybe is only 500 international units because they don't use milligrams. But anyway, vitamin D and sun, get outside in the sun. And if you can't do that, consider getting yourself a happy light or a mood light. They're getting much cheaper than they used to be. Another mood disorder that you're probably familiar with is bipolar disorder. And again, this is characterized by two different conditions. You have one condition, which is mania, and the other, which is the depression. The danger, well, this one is very difficult to treat because a patient may present or come into the doctor and they may be in a manic stage. And a manic stage is, I was just reading something down here. Oh yeah, I was reading on the handout here. Both of them, both the mania and the depressive stage, have low serotonin. One has high norepinephrine and the other has low norepinephrine. Norepinephrine is an excitator, so it kind of gives you some energy kind of thing, right? It's about arousal and attention and focus. So a patient may come in and they may be in a manic stage, and you may treat their mania, their extreme energy and their extreme euphoria with something that kind of slows things down, and that may in effect make their depression worse, because your depression is characterized by your inability to engage in any sort of goal-directed behavior. Right? So it's very difficult to treat the manic and the depression. Another characteristic or another thing that makes this extreme. So what do our definitions say? Periods of incapacitating depression and euphoria. So you'll socially withdraw, you'll go into this terribly depressed phase, and then you'll get like a burst of energy or euphoria. And one of the characteristics, I had a roommate, maybe you've heard me mention her in other slides, Amy Gadula, crazy lady. She had undiagnosed mania. And she would go through these periods where when she was manic, you know, she would decide she wanted to buy a van and move out to California, and she'd spend all this money. And if you said, that doesn't make any sense, why don't you like finish the semester and then maybe you can go out to California? Well, you were crazy. If you suggested that, you just didn't understand her, and she would be angry at you and resist any guidance or instruction. So it can be very difficult to live with somebody who goes through these where there's they can do anything they want, right? That's the manic stage. And they move out to California and they give up their job and they try to live in the beach on their van, and then everything falls to crap, and then they cycle through this big depression, right? So I had another friend who had bipolar, and she would stay up like 2, 3 days. She was an artist, and she would make a lot of art during her manic stage. So they don't necessarily have to be dangerous, but they can be very difficult to live with, right? Through these rapid states of extreme euphoria. And then, of course, then you have a lower level kind of bipolar, and these are the moderate, frequent mood swings. If you listen to the commercials, get the name of the drug that treats bipolar, they'll talk about how it treats, the manic stage, or bipolar 1 is the one that has both of them. One of them may have like a low level, may have a manic stage, and then a really mild sort of depression stage. Again, these show up in your 20s. If you get to age 30, 35 and you've not had a bipolar episode, you're probably pretty good to go. But this is also the same period of time where we're launching, we're going out into the world, right? We're moving away, we're getting our first apartment, and there's so many changes. And this may be when you cycle through your first bipolar in your mid to late 20s. Well, lithium is one of the current treatments. A couple different theories. I realize I've already done my 10 minutes, so I'll try to be quick. These things run in families. I think you've heard me say that before. Mood disorders, anxiety disorders, they run in families. You inherit your height, you inherit your hair color, you inherit your brain structure, right? You inherit your limited number of serotonin receptors, or your serotonin, right? You inherit the same stuff. There's a genetic predisposition. Serotonin, norepinephrine, dopamine all seem to be implicated. When we talk about antidepressants, I've talked about Prozac and all of those, they all work on serotonin, norepinephrine, acetylcholine. My daughter just started taking one. She tried taking Prozac. Prozac works on serotonin, norepinephrine, and acetylcholine. The one that she started taking, oh, here it is, I wrote it down, is Effexor, right? Effexor, and it is called an SNRI, and SNRI stands for serotonin norepinephrine reuptake inhibitor. She's really happy on that medicine. She feels a lot better. Remember, going back to this one, what is it? What is bipolar treat? Or bipolar is caused by serotonin and norepinephrine. So this Effexor is increasing the availability of both serotonin, which balances mood and sleep, and norepinephrine, which is an excitatory neurotransmitter. And yeah, that's really all I want to say about this. There is a relationship between people who smoke cigarettes. Question is out, is it this smoking cause disorders, or is it a form of self-medication? Certainly life events can trigger your first bout, right? It can trigger your first onset of depression or your first bipolar. You can inherit, it's just like anything else. When we were talking about alcohol and we were talking about drug addiction, you can inherit the genes, but if there's not a trigger event, you may not actually see the development of some of those conditions. All right, I come back. The last topic I will cover will be personality disorders.